So when we're cold calling, I want to ask this question. How many times a day do you feel do you need to call people? How many people do you feel you should be calling in a month? I challenge all the people that I work with to call a minimum of 50 people a day. 50 people a day. Well, somebody's going to tell me, well, Michael, there's not a lot of hospitals, there's not a lot of nursing homes, not a lot of assisted living communities in the area. So there's not a lot of people. What are you talking about? That's 50 people a day. That's 250 a week. If you're talking about a 20-day work month, you're looking at 5,000 people. That's not a lot. That's a lot of people. There's not enough people to call. Yes, there is. There's a lot of people to call. And the reason why I'm saying there's a lot of people to call is that there's a lot of physicians in your area. There's a lot of nursing homes. And when I say you're calling 50 people in a day, I'm not saying you're calling different people. When we create a follow-up process, we expect you to call everyone every day. Every week. So you really are only targeting about 200 people at a time until you can convert them into your VIP list. So in a daily basis, you should be calling a minimum of 50 people a day. Out of those 50 people, you're looking at about half of those should be for potential referrals. The other one are new calls. The first, potential referrals, which those are your follow-ups, and the other half, the other 25, those are your cold calls where they haven't really or met you or know anything about you. You're just trying to get that appointment with them. Now that's always the minimum. That's a 50-50 split. Okay? If you increase your calls, you also increase your follow-ups. You need to be able to have a follow-up training, a follow-up technique. So imagine that if you're calling new calls, if you go by the minimum, that's 25 a day. Within 5 days, that's 125 days, 125 phone calls in a week. So you're looking at what? So you're looking at literally, if you do that within 4 weeks, okay? If you do that into 4 weeks, how many is that? That is close to what? 500 phone calls a month. That's 500 phone calls a month. That's amazing. You just spoke to 500 new people a month. And that's the bare minimum that I expect of you guys, that I expect of your marketing team, of your liaisons and your marketers. So just imagine if you call 500 new people a month. And with the techniques that you're going to learn, you increase your potential appointments to about 20%. Okay? About 20%. That means you're meeting 100 people in a month. Now look at the conversion. Let's say, for example, you have a 7% conversion rate. Meaning after you meet 100 people, that you can convert just 7% of them. And that's bone stock minimum for people of average marketing capabilities. So now you're converting 7 new referral sources in a month. If you take great care of their patients, and each one of them, just let's say, for example, bare minimum refers to you 1 patient a month. If every month, within 10 months, you increase your referral census by 7 people referring patients to you, by the time that you hit the 10th month of your marketing strategies, you should have 70 new referral sources. And if they are giving you just 1 patient average a month, that means you should be able to have 70 patients coming in a monthly basis. That's creating a bone stock marketing strategy for you. So yes, you want to increase your calls, but you also want to increase the capabilities of your phone calls to be able to have a high conversion for appointments. And imagine if you learn some of the great, presentation techniques and adding products and services into your company to make yourself valuable to the patients, that's going to increase the conversion of those meetings towards potential referrals. So understand that the goal here is not the quick fix system, because if you don't have a follow-up process and system, you may get referrals, you may get a new referral source, but you may lose them immediately as well. So understand, cold calling is literally that important.